Aloha. Good morning, everyone. Thank you so much for joining Hawaii Care Choices Healthcare Talk Story. I apologize, there is a slight IT support issue going on, but we are going to get started anyway. Happy, beautiful Aloha Tuesday. I'm Tishler Lopez, your moderator this morning, and with me today is my co-host, Lani Weigert. Hi, Lani. Just a
Hi,
friendly
aloha, Tish. Aloha, everyone. Welcome.
Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All of our presentations are on our YouTube channel simply by searching Hawaii Care Choices. We are also on Facebook and Instagram, so please open up those apps, like and follow us. We have tons of content on there. Be our friend, send us a comment, throw us a shaka. We would love to connect with you. For those of us joining on Zoom, at the bottom of your screen, there should be a bar that says Q&A, chat, and polling. Please click on that chat box, say aloha, let us know where you are joining in from. We would also like to say aloha to all of those on Facebook Live. Use your comment box to say hello to everybody and then chat in any questions as well using that comment box. We have launched our Empower Your Choice Talk Story series last month, and this month we continue to discuss and explore the understanding of health equity and how it impacts your access to quality care. During this webinar, again, ask all the questions to our panelists using that chat box or the Q&A box as well. All right, I am so excited to introduce our guest speaker to you today. We have Denise Mackey. Denise has worked in healthcare for 30 years, starting as a caregiver in a long-term care setting while she pursued her bachelor's of science in occupational therapy. Denise worked as an occupational therapist in both nursing homes and home care settings before becoming a licensed nursing home administrator in 2017. Currently, she works for Health Hawaii Systems Corporation, East Hawai'i region, where she serves as the regional hospital administrator for long-term care and critical access to hospitals, including Hilo Medical Center, Extended Care, Yukio Okutsu State Veterans Home, Hale Ho'ola in Hamakua, or Hale Ho'ola Hamakua in Honoka'a, and Ka'u Hospital. In addition to her extensive experience in the field, Denise also has her Bachelor's of Arts in Psychology and a Master's of Science in Nonprofit Management. She has moved to Hawaii from Massachusetts in 2004, and since then has lived and worked in East Hawaii. Aloha, Denise.
Good morning. How is everybody?
Morning. We are doing good despite some technical difficulties. I'm going to go ahead and put up your slides here so we can just get this all started. Wonderful. All right. Without further ado, friends, please give a warm welcome to Denise.
Thank you. I appreciate and am honored to be invited to talk a little bit today about the long-term care in our East Hawaii area. And I put it together as an insider's guide. I think Lani was kind of asking me to do almost like a long-term care nursing home 101 for people. So that's kind of what this is. It's a little basic, and at the same time, I think we're going to jump off with some questions to delve in a little bit deeper. So yeah, if you can, I guess you're going to control my slides there, right? Okay, we'll move in. So what is a nursing home? A facility that provides residential accommodations and healthcare assistance, especially for the elderly. This is a picture of the front of our facility in Honoka'a. So in East Hawaii, we currently have 4 facilities in Hilo. They include a few private facilities that I'm not affiliated with, but I wanted to at least represent here. Hale'anuenui, which is a 120-bed facility. We have Hilo Medical Center's Extended Care, which is 45-bed facility. Hilo Legacy Building is 100 beds. Life Care Center of Hilo, 252 beds. They are the only facility with a specialized dementia unit at this time on our island. And then in Honoka'a, the facility here, Hale Ho'ola Makua, is actually a dual licensed facility. We have 66-bed nursing home side We also have an 11-bed critical access hospital where we do a lot of skilled nursing facility care. And then out in Pahala, the opposite direction, we have Ka'u Hospital, which is our 21-bed critical access hospital. They do have a special waiver on their license to house nursing home level patients. So they carry around a census of around 15 or so nursing home level patients for the community out there in Ka'u. So let's say you're at the point where you're kind of like, what do we do? Mom or a relative or somebody needs help, or you're feeling like you need more help. Why do you need a nursing home? Why would you seek one out? And so two major things, need help with caregiving, things like toileting, bathing, dressing, feeding, taking medications, walking or moving around. Mostly it's folks that are struggling in whatever environment they're in now. So whether it's a home setting on their own or a home setting with family, oftentimes it's becoming too much to feel either by yourself or to feel like your loved ones are able to manage that care. And that's where we move on to safety. If you no longer feel safe in your own home or with whatever caregiving you're getting, even with that level of support, it can sometimes become too difficult. So the benefits of a nursing home, I think a lot of people I think I've seen it in my career, and I think as an elder, sometimes it feels scary. I don't want to go in a nursing home. I heard that from my mom. I heard that from my grandma. I never want to be in a nursing home. And having been here for a long time, there's a lot of benefits to a nursing home, and it's not all about sort of this scary place that you're not going to get maybe good care or whatever folks might think. So I tried to highlight a few. There's a lot of activities programs that go on in nursing homes. And I think elders in their own home, they become isolated often. They're not engaging with folks. I think that sometimes when you enter a nursing home, there's just a lot more stimulation available, especially folks that live alone or are home alone for extensive amounts of time during the day. Being involved in things like crafts and cooking and having entertainers and just having different people to speak with can actually really help sometimes folks' cognitive status versus them staying home alone. Obviously, help with care. Some folks just cannot manage their own level of basic care. And then there's also supports, additionally, like rehab services in a nursing home that can help maximize your functional independence and keep you comfortable. And so making sure that folks are not just sitting in a chair all day, but instead they're getting up and they're moving and they're walking and they're maintaining some of that function. And then, of course, I think safety is the biggest thing, providing assistance with mobility, making sure you have that level of intensity of care that can sometimes be difficult to provide on your own at home. We have things called wander guards, which alert staff if patients are trying to leave the facility. That's particularly challenging, I think, for folks with dementia who, might tend to wander. We've heard that from homes, people leave their home and, folks are starting to get afraid for their safety. Most nursing homes will have an actual alert system. Only, like I said, Life Care Center of Hilo has a specialty program unit, which is a little bit different. That's their dementia unit. So then it's, well, where do I go, right? How do I know which one to choose if I'm looking for a nursing home? And I mean, I'm giving recommendations here. I'm not trying to market my own facility, right? My job here is to just educate, visit facilities, ask for a tour. All nursing homes should allow you to have a tour. If they don't, this is me personally, I wouldn't want to go to that nursing home. I want to be able to see and observe and, take a tour. So look around. Don't just go in and kind of be listening to what they're telling you, but what's happening with the residents? Do they look busy? Are they engaged in activities? Are they engaging with staff? Do you see that they look well cared for? They're clean, they're neat, they're dressed, they have warm clothes. Most facilities have air conditioning. A lot of seniors are very cold. Are they all wrapped up in a blanket or are they, shivering? For me, these are things that let me see that this facility provides good care. That they're taking care of their residents. Staffing, inquire about their staffing. What levels of staff do they have? Do they have RNs on duty all day, every day? What's the ratio of nurses aides? So how many nurses aides, or how many patients, I should say, does one nurses aide need to take care of? And does that feel reasonable to you? What kind of care does your loved one need? If you feel like they're needing a specialized dementia unit, and usually that would be folks that are struggling mostly with wandering behaviors. So they're trying to leave the home. You're worried about them, not being able to manage in a regular nursing home. Activities, ask for an activities calendar of the current month, see what's going on. You may not be there long enough to observe everything, but what does their day and week and month look like? How robust are things for your loved one? And are they doing things that you feel like your loved one might enjoy? Do they have a gardening group and a women's group? And these are things that your loved one might enjoy. Family involvement. Do they have an active family council? Can you join a meeting before your loved one is there? They may say no, but it's worth asking. What involvement can you have in the facility to check it out? Family councils are basically any family can kind of come. They usually will run like a once a month or every other month meeting. It's a place to both voice ideas and suggestions and also meet other family members and kind of have that camaraderie. We've also run sort of activities for and with our family council. So, family council has an idea and then we meet the families and we take, some residents and we kind of have an outing. And then what are the room policies? So what is the policy for making the room look home-like? Most nursing homes should allow that, but what kinds of things do they allow? Can you put pictures up on the wall? Can you bring in any furniture? The answers may be no, and this may not have you not go to that home, but it's just worth asking these questions because sometimes certain things are very meaningful and your loved one best. So you would know what things are going to be important to them. And sometimes matching up the nursing home and some of their policies or what you see is more important than, maybe looking at the beautiful chandeliers or the lovely artwork that the nursing home has up. Those are important and they're nice, but, I just encourage people to really inquire and find some things out about the care and the environment that maybe suits your loved one.
Denise, I'm so glad you talk about, asking questions and just kind of being open. And, I just wanted to know, what is the average age of patients staying at a nursing home and what's the average length of stay?
Yeah, so some of this stuff, again, like I wanted to get updated data. And so I have some research, the CMS data, which is the Center for Medicare and Medicaid Services, which is really our kind of our governing body, so to speak. They're the regulatory entity for nursing homes. They had data from 2020, which basically said that 50% of nursing home residents are 85 or older. And then there's very few was actually the data younger than 65. That doesn't mean there aren't folks younger than 65. There are. I think, again, depending on the age of your loved one, you may want to ask those kind of questions because some nursing homes almost have an unwritten policy that they don't want to take folks under a certain age. And if your loved one is, sometimes people need homes early. There's a medical issue or a medical combined with care need issue where you might need care at a younger age. And so say you're in your 50s or your family members in their 50s. It would be worth asking the nursing home not only their policy on that, but how many other folks are of a like age, because the group activities and the things that they do and how they cater to a very mixed population can be really important. 50-year-old is probably not going to want to engage in some of the same activities that perhaps an 85 or 90-year-old would enjoy. And so I think that's important. The other data that they had, and this was actually from Health and Aging Foundation, so 50% stay 1 year, 25% stay 5 years or more, and 25% are there for short term typically and stay 3 months or less. So that's national data. So the only data that I had really easy access to was my facility here in Honokaa. And so just as a reference point, we kind of matched up. So our average length of stay for our long-term folks is anywhere between 400 and 500 days. So a little over maybe year and a half. Short-term, our average length of stay is 25 days. So just about a month. Folks come in, they get their rehab, they get their nursing care, and they go home. And that was usually their plan. And so we have range. Some folks come in their long-term care and they're not here very long. And some folks come for long-term care and they're here for 8-9 years. It just, yeah.
Right, on their need.
Yeah.
I know you mentioned, precautions that you take if a patient has Alzheimer's or dementia. What percentage of patients are on memory care or have, Alzheimer's and dementia? And are there additional different accommodations for them?
Yeah, so again, Alzheimer's Association 2020 data, 48% of nursing home residents have dementia diagnosis, not just Alzheimer's, but a diagnosis of some sort of dementia. I would have guessed it was higher than that, honestly, but that's their data. I did see also some other reports of around 50%. So it seems like that's kind of the consensus. Some nursing homes do have specialized units, like I mentioned. So Life Care Center, I don't want to speak for their entity. I don't work for them, but I've worked on the mainland in specialized units. Typically they're secured, and they usually will have access to an outdoor location that's also secured. So they also provide typically a higher level of sort of programming for folks with dementia. So they might offer like communal dining in a more family setting, or specialty activities that are really geared all toward folks with memory care issues. And they might tailor them to what you might typically expect in the afternoon. Folks with dementia tend to experience what we call sundowning, where the afternoon is a little more challenging, and so they might tailor their activities a little differently in the afternoon toward a real specialty population. I think in a nursing home that does not have a dementia care unit, they still have roughly 50% of their population with some level of dementia. And so I think our governing body, again, the Centers for Medicare and Medicaid Services, they actually require us to do annual training with all of our direct care staff on some level of dementia care, cognitive, deficits, and how to care for folks with cognitive deficits. That's a newer regulation, really, from I think like 2017, although I think most places provided that education before that. They also do require us to tailor activities toward populations. And so I think most places that don't have a specialty unit will not necessarily like have everyone in one area within the building. They're kind of mixed within the milieu, everybody with all different diagnoses. We try to, if you have roommates, we try to pair a roommate, with like mind and things that they enjoy, things like that if we can. And we also will run certain groups that might be tailored towards certain levels of cognition. So we might run like a sensory group for folks that really need that level, and then much higher level groups for folks that maybe cognition is not a barrier for them. Does that make sense?
Yes. Thank you so much, Denise, for all that information.
I had a question for Denise too. Denise, in your experience on the mainland with the memory care units, what did that look like, with regard to inside the facility and then their outdoor facility? How did that look?
So actually, I worked in 2 facilities in Massachusetts that had specialty memory care units. Both of them had access to the outdoors. However, they were not set up the way I would have set them up, right? Had I been the designer. They actually were not set up on the first floor. Both of those specialty dementia units were on the second floor of the facility. And so they had like a backyard that was sort of like enclosed and secured, but you had to sort of take folks out there. And so it was not like the way I've seen some other, on line on TV or in education or trainings. I've seen some where there's literally like an outdoor that you can walk right into. Actually, I take that back. I believe there was one that I actually didn't work at that I visited in Massachusetts that was like that. Like you literally could walk outside in this enclosed sort of garden area. But the 2 I worked with didn't really have that capability. You had to actually bring folks out. However, they were set up to look less like a nursing home and much more like a little community. The nurses' station was set up in like a country setting. It reminded me of like 2 windows that you would go to if you were ordering like ice cream or takeout, and then you'd go to the other window to get the pickup. That's what it looked like to me, so I think they tried to sort of make it look a little less threatening and a little more home-like. And they both had like family style meals. So you sat down at a table and, you kind of served out of the big pot like you would at family style. And so I think, it just they felt different, you know, and the aides were much more highly trained, I think, in working with folks with memory care issues. It was a specialty of mine as an occupational therapist. I was actually trained as a dementia care specialist. And so I worked in those 2 units with any new admissions that we had. And, you know, we would try to figure out their likes and preferences and the types of cues they best responded to, and then educate the staff. And so I feel like they had a pretty good program. And I certainly hear good things about the Life Care Center program. I just can't speak to it personally.
Thank you. You know, not to just jump down a deep rabbit hole, but we're largely interested in the memory care side because we seem to be getting quite a few requests for that. So with regard to the specialty of the staff, what would you say are like the top 3 things that you would actually go out and teach?
Well, I mean, so as an occupational therapist, but even more globally, I guess, just looking at it, I think approach and communication is probably the biggest thing. And that could be specific to a person, because you might learn by working with a person or talking to family what works best for them. Oh, they respond best if you use gestures, or, oh, don't do that. Gestures are frightening for them. You know, there's unique individuals will have their own preference of style. And then in general, I think just generalized training about how to communicate with folks who are having cognitive issues, you know, understanding. I'm a really fast talker, as is probably obvious. But when I work with someone who I know has memory issues or you know, cognitive deficits, I'm going to take a really long time waiting for a response. You know, I'm going to try to slow my communication down as best I can. I may or may not simplify it. It depends on the person. I'm certainly going to give perhaps 1 cue at a time, or one request or 1 ask at a time. So there's some strategies that would be for everybody. And then there are unique things about every one of us as to our learning style and you know, our past experiences and how we relate to people, that I think can be important. So I think, you know, communication, looking at the individual. I think also maybe that's probably the other big thing, is understanding what things were like for folks at home. Yeah. And so I think some of the things we've seen that I think have caused difficulties in the past is not understanding maybe somebody's preferences. So you might have somebody who has slept in a recliner for years, and then suddenly you're bringing them into a home and you're saying, here's your bed. And then, you know, they're getting up and I think staff maybe not delving into the why behind somebody's behavior, you know, so, and just calling it a behavior. Oh, they don't want to, you know, stay in bed. They keep getting up all night. But having conversations with family or loved ones, or even the resident themselves, and asking them, what do they need? What is it that they want? Someone that has dementia, they're still there. Okay, they're still a person. And I get goosebumps when I talk about it, because I think sometimes I think that happens sometimes, that because they can't always answer the question, we tend to forget that there's a person inside. And so I think trying to ask questions and see if they can answer you and tell you what they want or what their needs are, I think is really important. And then maybe just looking at likes, dislikes, activities, things like that I think would be helpful for a population. Any population really is important. Understanding what things would be both personal, cultural preferences, and then, you know, meet their needs. I mean, those are probably your biggest education opportunities.
I really appreciate your comments, Denise. They're so valuable and heartfelt. And this is really the kind of approach that we would want definitely for any of our family members who might be suffering from that, to know that if they went to a nursing center that provided that kind of care, I mean, how wonderful would that be? Thank you so much for sharing those top items. We can continue on to the next slide, Tish. Thank you.
So what else do you need to know? I think some of this is important maybe right now more than even it used to be. Nursing homes across the country, they're having a lot of staffing challenges. It's not just nursing homes. I mean, restaurants are closing and KTA no longer opens, you know, past 9 or whatever it is. there's staffing challenges in our community and in the world right now. And nursing homes are no different. And so because many nursing homes are short-staffed, they're not able to fill their beds. And so that goes on to the next question. And then the next few things is, have a backup in mind. If you're really looking for a nursing home, or you're looking, have a second choice and a third choice, because the first one may not be accepting new residents right now. And, we do live in a small community. We don't have lots of choices, but I just encourage people not to get fixed on one place. And then they can't get in, and they're really disappointed. And so knowing that maybe the second choice is okay. And at the same time, you can always ask to be referred back to that first one. You can ask to continue to be on their waiting list. I think most nursing homes that are short-staffed right now, they're what we call capping their census. And that's to basically maintain good care and safety. And so there is generally a waiting list on most nursing homes at this point. Sometimes, they may all of a sudden open up and they'll take a few patients or residents, and then suddenly, no, we can't take patients for a week or 2 weeks, or, and I think, payment source can be an issue, particularly for our for-profit nursing homes in the community. And I don't judge for-profit nursing homes, because they have to make a profit. It's what they are. And so they have to be very mindful of making sure that they can continue to operate and provide the valuable service that they do to our community. And so, they have to make sure that they're going to get paid, basically, if they take somebody. And so they often look at Medicaid and Medicare and making sure insurance is there, but, checking in to make sure that you have a payment source. So, some of our folks own homes, and, what do I do? And it feels very overwhelming when you're dealing with trying to place your loved one somewhere. And then you have all these money questions and all these other, it's very stressful time for many, many reasons. And so I would not answer those questions for you. I would seek out a professional, a lawyer or someone who can help you if you're dealing with, the finance side of things. There are some supports in the community as far as being able to have someone help navigate you through the Medicaid system, because it can be very challenging. But I think people that own property in particular, or things like that, I think your best bet is to consult a lawyer so they help you do it the right way. And sometimes they can help you navigate through some of these hoops that the government requires us to do in order to qualify for things.
With all of these kind of obstacles that could get in our way, do you feel that pre-planning might be a good idea? And then how far in advance should someone kind of start looking into these things?
That's a really good question. I think and it's hard to predict, because sometimes, you can think that your loved one or yourself is fine, or you can think you don't need that, or you can have challenges where maybe it's a parent or somebody that you're trying to help and they're not ready. And so, do you sneak behind their back and go look at nursing homes? And, ultimately it'd be nice to involve them, right? And so there are so many, I think, dilemmas and kind of questions that come up. And I think it's a good thing to pre-plan. I think it's nice to know what's out there and what, just basic information, what am I going to need to do? The more you can pre-plan, the less stress at the time that it happens. And yet it's hard to plan life, because we're all humans, and we can't predict what's going to happen to ourselves or our loved ones. And so sometimes you think, oh, I got a couple of years with my mom, I don't need to worry about that. And then something happens and you don't. So at the same time, you could be pre-planning and it doesn't happen for 2 years, and, go check out the nursing home again, because things may have changed in that home, So I think it's good to have some understanding of these are my choices. And we're only talking nursing home. There's also care homes in our community and other options. But I think it's good to get a general sense of what's out there. Understand if your loved one is starting to experience some difficulty and challenges at home, that might be a time you're starting to hire care, or you're needing to provide more care. They're struggling maybe to be independent. It would be a time to start figuring out what your options are. And nursing home is only one of them.
you. Thank you so much for that. We have in the chat, when you were speaking about dementia care, Pamela said AARP and HIAC are doing a workshop November 4th regarding positive approach to care. And we want to know how to register for that workshop. Pamela, do you have any information on how to register? Just please go ahead and put that in the chat. I'll go ahead and advance your slides, Denise.
Yeah, no, that's great. I mean, I think seeking out training like that, that's helpful. And Alzheimer's Association, among others, runs lots of really nice trainings. There's lots of YouTube videos online with, approaches that I think there's a lot. We're lucky that we live in this digital age. There's a lot out there, both as a family member to learn and as a caregiver. I'm going to have a little aside here that I'm thinking of. I've worked in this field for a really long time, and I'm a dementia specialist, right, as an OT on the mainland, and my mother has dementia. She lives on the mainland, and she's struggling more and more. And going through it on a personal level, I'm seeing some things that I guess I didn't know that like I'm learning, and I'm like, wow, not that I thought I could never learn more, but I'm learning some things that I thought were correct are now not correct. And so, things that like, this idea that, long-term memories are preserved. That's it, long-term preserved. It's the short-term that people lose, and kind of had that sense that there was a little fluidity to it, but yeah, that made sense. And my mom's long-term memories are quite distorted, particularly with time. And because I know her life. And so I know the answers to these things that she's telling. And it's like she's kind of rewriting some of history, and she's kind of and not purposely, I just mean that's what's in her brain, right? And she's compressing time, such that like something that happened maybe 3 weeks ago is yesterday, and so it's just, and if something happened 20 years ago, she thinks it maybe was like a month ago, so it's just very, very interesting. And so I think you can always learn. I think there's always education out there, and everybody's different when they experience cognitive decline, and so understanding that too, that it's a really unique experience. It's your whole cognition, it's not just a memory loss or something like that. Yeah. So anyway, onto our slide here. So be an advocate. I think this is my biggest message to people. Speak up. We all have a really strong, a powerful voice. Ensure that you ask questions on behalf of your loved one, or if you are someone who are seeking out a nursing home and cognition is not your barrier, ask questions. You know yourself, or your loved one best and what they need. You want to provide the staff at the nursing home with information that can help them to better care for your loved one. So what kind of foods do they like? What is their preference for bedtime? Do they have any rituals or routines that they practice? Sometimes it's things that, I think, like I said, with the example of the person trying to get out of bed, understand what happens at home, and know that if you share that with, the folks at the nursing home, that's helpful. They'd like to watch TV until 11 o'clock. They don't go to bed early. Or my dad woke up at 4 a.m. for the last 20 years. That's his life as a retired person. He liked to get up before the sun. And if they know that, they're going to expect that, and they can use, most nursing homes can work with that. They just like to know, and so I think super important to speak up. Visitation rights. I don't think this is usually an issue, but people often ask, but can I visit anytime? We have folks that, I work double shifts, but I want to show up after work at 11 because that was my routine with my dad. 11 o'clock at night, we would chat a little bit before we went to bed. Can I do that? Yeah, there's no visitation restriction in a nursing home. I don't know about care homes. Those are run separately, but by regulation, you can visit anytime, day or night. Some nursing homes will lock the doors and secure them at night for the protection of staff, but usually they have a way to call, phone outside or something that you can say, I'm here to visit, and they'll let you in. Yeah, so just asking those questions and just being involved, I think, is really important if you can. Participating in care plan meetings, which are offered by the facility, joining family council, groups if the facility offers those. I think sometimes people are afraid to advocate too much. They're afraid to speak up. They're afraid to rock the boat, or they're afraid that I don't want to upset the nursing home staff. We hear it from residents here. Oh, I didn't want to complain because I don't want to upset the staff. They try real hard and they do a good job. And that may be, but we're here to serve you. We're here to be better, and we're here to provide the best care we can. That's why we're here. And so I think, you know, you don't have to be an advocate in such a strong way that it comes off like you're being rude, right? You're just an advocate. You're just asking for what you need. And the more information you provide, and the more you're seeking information, the more involved you are, the more you can make sure that the nursing home provides the best care for you or your loved one.
It comes up with a question that we have. You mentioned CMS, so the question is, do nursing homes have a federal oversight that does affect the quality of care in each facility?
Yeah, so nursing homes as an entity, long-term care, are governed by the federal government. Lately, you've seen, you know, Biden comes out with a proclamation, and it starts with the president or the legislature. Centers for Medicare and Medicaid Services is our governing body. Its abbreviation is CMS. And so they basically set all the rules. And I've not looked at nuclear industry rules, but what I understand is the nursing home industry regulations are much more strict and bigger volume than that, because we're taking care of elders, and we're taking care of you know, people that are perhaps vulnerable. And so there's lots and lots of rules and regulations that govern our care that we provide. Each state is generally responsible via the federal government for running the survey process, which is basically an annual on-site survey of your facility, where they send in a couple of surveyors and they ask questions of residents and families, and they look at your documentation, and they make sure that you're following the rules and providing good care. And the federal government oversees those surveyors at the state level. And so what happens is the state, in our case, it's the Department of Health, the Office of Healthcare Assurance, which is a division of the Department of Health, that is the survey entity. Those surveyors, basically their boss is the federal government, which for us is based in San Francisco. And so the survey team from the Office of Healthcare Assurance in the state of Hawaii comes out annually to each facility and does a really thorough survey, usually over the course of a week, sometimes longer. The federal government is responsible by regulation to survey 5% of nursing homes in each state, in addition to the state entity. So basically the federal government comes in Hawaii every year and randomly picks 5% of our 42 or so nursing homes that we have in the state, and they do their own additional survey. And the purpose of that survey is to make sure that our state Office of Healthcare Assurance is actually doing the job the feds hired them to do. So basically, let's say the state comes in and they cite you for this and this and this. The feds come in and they want to see that that seems accurate. The state survey is doing a good job of making sure that we follow the regs. But then the federal government can cite you as well. And so as a nursing home, you could actually have two surveys in 1 year, both the federal government and the state. So there's actually lots of federal oversight, and also the state kind of as a layer. I hope that answers the question.
Yes, it does. Thank you so much. Go ahead and advance your slide. Oh, that was the last slide. Apologize.
That was kind of our jumping point, because I think advocacy is probably one of the most important and biggest things, at least for me. You know, that's kind of my passion.
Definitely. I'm going to go ahead and stop share here so we can talk stories just a little bit more. Another question came in. Are there benefits to nursing homes to have patients that require certain medications for anti-anxiety or maybe mental health meds to be under hospice care?
So, yeah, I think just in general, so nursing home compare is what anybody can look at to rate basically a nursing home, or look at a nursing home's rating online. And so it's part of the Medicare.gov, I think, website, and you can Google nursing home compare and you'll get the, you know, and then you can narrow it by zip code. So you can put in the Hilo zip code and it'll show you all the nursing homes in the area and their star rating. So it's a 1 star or 0, I suppose, to 5-star rating. And so 5 star is top. That means you're top nursing home. And there's only like 12% of nursing homes across the country would achieve a 5-star rating. And so that it's kind of like a bell curve that they do. So basically, within the star rating is also a component of the star rating is looking at what we call quality measures. And so it's all these areas of care that are really important. And the federal government has assigned them significance based on what they believe to be representative of quality of care. So it's things like the number of falls in your facility or the percentage of fall rate, whether you have any falls with injury, wounds, you know, are you, you know, not having, you know, wounds develop in your facility, you're managing people's pain, they're not losing weight. So just in general, nursing homes goal, according to the federal government, this is our thing, we're supposed to at least maintain or improve people's function when they're here. And that I think is what's interesting, because for most people that think of a nursing home, they might assume, well, that's where people go and that's like an end of life. And we know people are going to maybe get worse as they get, you know, their illnesses become, you know, more pronounced for them. But our directive from the federal government is maintain function or improve function. So it's sort of, it's difficult because it's not what we actually think of when we think of elderly folks who might ultimately have what we expect to be a decline. So if someone opts for hospice care, there's not many, and I personally think there should be more, but there's a couple of areas that the nursing home is basically allowed to show a decline, because the person is now hospice and you're really expecting that, in fact, at some point they're approaching end of life. One of those is weight loss. And so a lot of times when people start nearing end of life, they just don't eat as much, and they start having malabsorption issues, and they just start losing weight. And so if someone loses weight in a nursing home and they're not on hospice, that becomes a quality indicator trigger for us, and it reflects on our 5-star rating. If they're under hospice care and they start losing weight, the federal government says, okay, that's expected, that's okay. Psychiatric meds are a little bit more tricky. Under hospice care, you can use anti-anxiety meds and it won't trigger on our quality indicator. However, antipsychotic meds, which are sometimes used by physicians with folks, especially if they present with dementia with behaviors. So, you know, the dementia is now causing, for some people, they're screaming or they're yelling or they're throwing things at people because they just don't understand. A lot of physicians or psychiatrists might recommend, or neurologists even recommend, an antipsychotic med, and it sometimes helps. Mm-hmm. However, even if they're on hospice care, if you use an antipsychotic med, it still triggers us on our quality indicator, because we're not supposed to use antipsychotic meds unless you have a previous diagnosis of like a schizophrenia. They also allow, I think it's Huntington's and Tourette's. There's like 3 diagnoses that they allow you to have. And they say, okay, if you really are a diagnosed person with schizophrenia, you in fact need an antipsychotic med. But if you're a patient with dementia who now has behaviors, for whatever reason, I don't always agree with every rule and reg we follow. I have to follow them. The rules and regs say that that's not an indicator for an antipsychotic, even if someone's on hospice care.
Thank you. We had a question come in. What is your understanding or experience of the value that hospice adds to the residents of nursing homes when the resident becomes eligible? I know you touched on that a little bit, but if you'd like to expand it.
Yeah, so I think, you know, I can speak mostly that the facility that I'm most heavily involved in, my role is regional, but the one that I'm kind of home based on, and it's where it's basically my nursing home is in Honoka, Halehola-Makua. So I think that hospice is an added value for folks in a nursing home. You know, that there's supports above and beyond the nursing home staff who have expertise in end of life issues and comfort. I think some of the meds that we see folks on, they're palliative care meds, and so the whole focus is around providing, I think, comfort, right, for folks as they start nearing end of life. And so some of the med choices are a little, I think they're more geared toward that. You folks have an expertise in that, and so there's an expertise there that most nursing homes wouldn't have. There's additional staffing that are coming in and checking on the resident. So I think just from a personal perspective, if you're a family member, you now have another entity to talk to and say, hey, how's mom doing? Or what are you seeing? I like to think that nursing homes all provide really good care, and yet I don't see any harm in having another person then come in and be able to assess how is the care there, and how is mom doing, and what do you see when you come in. There's added support services, and you guys would be able to speak better to the breadth of services that you offer, but I know there's social work and social worker and other kind of services, I think, for families that the nursing home may not be able to provide, whether it's support or counseling or things like that. As far as our residents, I think, I think we utilize hospice fairly robustly in our facility here. I think we self-offer it as a service for folks. I think if folks advocate, that's fine too. But we often, as we see people starting to struggle more, and the doctor feels that they're approaching, not so much end of life, but they're starting to struggle a little bit more, and they're not wanting to seek aggressive care. I think, the physician here will often talk to them, as will our social worker, about services that hospice could offer, and see if that's something that somebody would want.
Thank you so much, Denise. Yes, there are a lot of resources there, and it's nice if hospice and the nursing home can, collaborate together on that for the better of the patient. Not all nursing homes do that. So I just like to ask, in your opinion, why would nursing homes maybe not reach out to hospice for their services in collaboration with that?
So I'm kind of laughing because you've asked me this before, and I'm not sure I have an answer for you. We understand the value here in Honokaa of hospice. I mean, I think our census in long-term care was around 50. We just had 5. I mean, I think we just dropped a little bit, but we had 5 of our 50 on hospice. Not everybody's eligible, not everybody needs hospice, but the ones that do, we certainly encourage. And I think for some folks, it's whether it's they're seeking less aggressive care. Maybe they have been someone who's been back and forth to the hospital a little bit, and they feel done. I don't want to keep doing this. I don't want to keep going to the hospital. Whatever the reason may be, I think, we've utilized hospice well here. I think it's not only, it's helpful to us as a facility. I think it provides another eyes on, another, on a resident. It helps with the quality of care, as far as, like the services that you guys have expertise in that we do not. We feel now like we're enhancing the care that we can provide to our residents. Why would we not? I guess I can't answer that. I don't know. It's not something that I've seen before. I think I've questioned, is there like some financial issue? I don't know. I can't answer that for folks. I know that for us, it's a real valuable service, and we're more than happy to engage with, hospice services in our facilities.
We did definitely talk about that a little behind the scenes. I'm glad that everybody could kind of hear our talk story as well. Lonnie, what's your feelings on that?
Well, I was so interested in that thought, Denise, that, most people come to the nursing home and their condition is either maintained or improved in some way. And then if it's not, clearly hospice could be used as an intervention, especially if an obvious sign is somebody isn't eating, so they're losing weight, etc. In your experience, do you feel that that is widely known? Because it's clear, just based on what you shared with us, that it would immediately or directly impact the quality measures that a nursing center has. It would affect their star rating or whatever if they're not using hospice as an intervention. We're just trying to drill it down so we really understand if there's benefits to the nursing center, why wouldn't they use that if that would be a intervention?
Yeah, I mean, I think you're right. I mean, I think that there may be some lack of education, lack of knowledge. You know, there are some newer nursing home leaders in the Hilo area who I can't speak to their knowledge on it. They may or may not understand that. I think that education is important, you know, on what hospice is, what hospice does, the scope of your services, what you can offer. I think it's probably going to start with the residents and the families themselves. And the more they advocate and the more they know and the more they're aware of the service, I think, you know, sometimes you learn from others. You learn from a family member or a relative or a friend or somebody that's utilized the service, and you hear good things. And then, but how does this apply to my loved one? And I think that's why it's important to be a part of those care plan conferences that the facility has. They'll talk about the status and you know, are they declining? How's their weight? Are they participating in activities? If you're able to visit because you live locally, well, you're seeing those things. You know, I don't know. I've noticed mom's not eating as well, or I'm bringing her favorite food and she's just picking at it, and I'm not. You know, ask the staff. I mean, ask questions. You know, don't be afraid to ask. And yet, if you feel like, you know, there is a real decline, and you know your loved one's wishes, and you know kind of where they were at with their desire to pursue, you know, higher level of care. I mean, I would imagine, and I'm asking this question myself, Lenny, I would imagine that they can reach out to you folks just on their own and say, hey, what do you guys offer? You know, my mom's in a nursing home, you know, and you know, what can you do? Is there anything that you could do, you know, and how do I go about, you know, having you guys at least come and talk to me or talk to mom, or, you know, and I mean, you know, you guys would know kind of that process, you know, and so offering maybe more education or to the community, or maybe broadcasting that you guys are available. If someone wants to call and just find out, what does Hawaii Care Choices do? And what does that mean for me or my loved one? Or my mom's in a nursing home. She's already got a nursing home. What would I need hospice for? That's for in-home care. It's up to you to probably try to find a way to educate the community that it's more than just care in the home, right? It's, you know, that there's care across the spectrum. And you know, you follow folks to the nursing home, and there's valuable resources and services you can provide there.
This is perfect. And I'm glad that you brought it up, because this is the reason, the exact reason that we do Talk Story, because it is about education. And we'll be able to, just to let you know, we'll be able to send this link out now to all of our donors, etc., so that we can just keep the education going. Because really, the reason we have these kinds of talk stories is to empower our community to be able to just ask for it, you know, instead of wait for somebody to say, hey, you know, by the way, you know, you qualify for this, where the information that you have given us in just this very short time. And actually, in the last few minutes, I'm going to ask you a few more questions, but it's just invaluable, because you just like cut right to it. You know, there isn't a lot of fluff or, you know, padding on this. You just went right to it, and anybody can really explain what you're trying to say, which is awesome. So out in the news, Brenda shared that we will be opening a residential care home. We will reopen our Ho'aimalama Care Center as a care home in January. We're so excited about that. And we will be giving preference to those on memory care. So in our last few minutes, I just wanted to ask you, what do you think would be maybe the top 3 things that you could advise us on with regard to being better prepared when we open this to our community, because you understand all about, you know, the memory care type of industry?
Wow. Let's see. I need to think about this for a minute. I mean, I think, again, probably for you folks, the importance of education, finding education for your staff, for your leaders of the facility, so they know what they're marketing and what they're doing, and what service are they providing, and what is their core mission, and what are they, you know, trying to provide. And then at the same time, that downstream education of, how to actually care for someone or communicate with someone who has memory care issues or Alzheimer's or something like that. I think, again, not knowing the regulations around a home like that and what you would be looking at, I think, if you have the ability to set something up where you're really involving families, whether you're running regular, interdisciplinary meetings or regular family meetings about their loved one, I think that can be so helpful, both to you folks and to them. I think for you folks to get an understanding of maybe more knowledge about the loved one, more knowledge about their needs, more knowledge about them. And also the better that communication, the more folks' anxiety and stress is relieved. And so we found this during the pandemic that, if we had stuff going on in the facility and we were unable to allow visitors at that time, right, all the nursing homes had to close down. Mm-hmm. We were, making phone calls to families like a couple times a week, just giving updates, especially the folks that couldn't communicate. And so I think knowing that if you're taking a really advanced memory care population, and if you find you have some families that, I don't know, the families on the mainland, or the family just can't visit a lot because they live in Kona and they're just not able to come. And, the more robust that communication, I think, both on behalf of the resident, if they're unable to participate themselves, it's going to create a more, almost a home-like kind of feeling, for you folks, right, to run a home like that.
Yeah.
Yeah. And I think, I mean, just again, along the same lines as education, probably making sure that the activities kind of program that you're setting up is robust and that it's tailored to a population that you have. I think folks need stimulation no matter whether we have cognitive deficits or not. Every one of us will suffer and perish if we're not stimulated enough. And so I think making sure that you're able to provide that level of activity program, more than just here's TV night or here's, which those are okay, they're supplements, yeah. But having someone who's actually engaging people, they're doing arts and crafts or gardening, or I think the benefit of a smaller facility like that is being able to offer those kind of things, and just, I guess, making sure that someone has expertise in some of that kind of program development, because it's not just about providing good physical care to somebody and making sure they have food and making sure, that's like the Maslow's hierarchy of needs, right? The bottom is just the home, the food, the care, and then as we start getting up higher, we start looking at things like programming and activities, but those are really important. So I know that's off the top of my head. If I had more time to think about it, I might give you a more robust answer, but
that's awesome. You actually are taking us right home to our final second. So that's incredible. All of the information, Denise, that you gave us is just so valuable. We really appreciate it. And we're so thankful that we were able to record this, because other people will be able to learn from your words as well. I thank you so very much. I'm going to take it right back to you, Tish. Any last words before we go?
Thank you so much, Lonnie. Thank you again, Denise. Your knowledge is
You're welcome.
Valuable. Friends, this will be on our YouTube channel. Just go to YouTube and search Hawaii Care Choices. This will be up by the end of today, if not tomorrow. We always have our healthcare talk stories the 10th of every month at 10 o'clock, unless the 10th is on a weekend like it was this month. But our next one is Tuesday, October 10th. Be on the lookout for that registration link. Visit us on Instagram or Facebook. You can also see it there, or visit our website, hawaiicarechoices.org/healthcare talk story. Or you can always catch us live on Facebook. Denise, is there any last words you'd like to give our listeners?
No, thank you so much. I appreciate the opportunity. I was love talking with you folks.
We absolutely enjoyed talking with you as well. Mahalo again. Thank you everyone for joining us. See you next month. Until then, ahui ho, ma'alama pono. Aloha.
Aloha.